Hey guys, welcome to another video. So today I was just going to briefly talk about sciatica. This is something that we commonly treat in our office. It's probably one of the more common things that our patients will present with. And I just want to kind of quickly go over, what it is, what we see, how we diagnose it, and then just generally how we approach it when it comes to treatment. So just a little bit of anatomy to start. So our sciatic nerve is, it's a large nerve that it starts, and I'll kind of show you from our low back. You have nerves starting from lower lumbar and sacrum. They form together close to the hip side, and then they travel down the leg. And that's important because areas that it can become entrapped are where the nerve really starts to get to its biggest point. And the most common place is around the hip, specifically around muscles which rotate the hip. We call them hip external rotators. Some other places it can be entrapped could be around the hamstring, and when it bifurcates or splits below the knee, you can have some entrapment around it there as well. But the most common place that we see is definitely around the hip. But one thing that we do have to rule out or take note of is, could we have some irritation actually above the hip, which is known as radiculopathy? Is there any pressure on the nerve roots which exit from the spine? And we do some very specific tests in the office to kind of get an idea if it's starting to lead that way. And that is really important because if that is an issue, we have to decide if we need to do something like some further imaging, or just overall, we're going to treat it a little bit differently, okay? But when it's truly an issue at the sciatic nerve, either from the hip or down, our approach to treatment is the best response to it is going to be a lot of manual therapy, because that nerve needs to be able to glide and slide around a lot of the soft tissues that it runs by. And if it's not, then that's when we get the best results we like to use ART in our office, because we can get kind of the best result as far as restoring that normal glide from around the nerve. Normally when we're moving our limbs, again, our nerves are just gliding by tissues. If they're not, they start to stretch a little bit. And if they stretch too much, that's what's often giving us a lot of our symptoms, okay? So that leads us into a couple other things as far as treatment goes. We want to make sure that the advice that we're giving to our patients, some of the home care things that we're giving to our patients, are things that are not going to aggravate that as well. Most things that we do between sitting, lifting, bending are all flexion dominant positions, and those are all things that can irritate. So of course, we're not going to send our patients home with more of that. We're not going to have them do a lot of exercise like pulling their knees to their chest, a lot of hamstring stretching. We're going to tell them to avoid that until things start to calm down a little bit, and we'll give them some alternative things to work on as well. Obviously, we're going to adjust most of our patients when they have this condition as well, particularly around the sacroiliac joint. We'll find some restrictions in the lumbar spine, but based on what the patient's function is telling us, we'll even look above and below that area and decide if we need to address or adjust those areas as well, okay? That's all I've got for you guys for today. If you have any questions, please feel free to let us know, and we'll talk to you next time. Thanks.